Welcome back. This is the nerve, spinal cord, and reflex unit. We are on video 3. So we are up to cranial nerve number 5. This is called the trigeminal. So tri meaning 3. This has 3 major branches. And it's a pretty interesting nerve because it does a lot of things. It has sensory. So it provides sensation for the forehead, the scalp, the neck, and the face. So a lot of parts of the head, knowing that it's hot, cold, pain, whatever, is a branch or branches of the trigeminal. So we have things like the mandibular nerve, we have the facial nerve, and so forth. Motor, this is responsible for mastication, which we know is a fancy word for chewing. Parts of the middle ear that need to function, the throat, and what is known as the corneal reflex, which deals with closing the eyes. This is also dealing with awareness, so it's proprioceptive. Now, if you wanted to test to see if this nerve was functioning well, because it involves chewing, the doctor is going to tell you to clench your teeth, which means you try to bite down and you clench your teeth. So weakness in clenching the jaw is a sign of a lesion. You can also have loss of facial sensation or intense pain. So with this one, we end up with trigeminal, I'm trying to remember what the name of it is, but there's a condition where this nerve can get irritated and it causes intense pain in the face. And you end up with having to go in and trying to remove anything that might be irritating this nerve. Nerve number 6 is called the abducent nerve. This has a motor function, one eye muscle, and that one is called the lateral rectus muscle. And with this one, if we have a lesion, the eye deviates medially. So it goes inward, almost like a cross-eyed function. Nerve number 7 is the facial nerve. This one is proprioceptive, so I'm just going to mark it down here. This has a lot of functions, just like the trigeminal. The anterior 2/3 of the tongue, so it helps sense that. It helps with our sense of taste. Sensory of the palate, so the hard and soft palate, and the external ear. Motor function, facial expression, the throat, and the middle ear. Parasympathetic, we have the lacrimal glands. The lacrimal glands are going to be your tear glands. And 2 of the 3 types of salivary glands, the submandibular and submaxillary glands. Now, because this controls facial expression, facial palsy can happen. Palsy just means that something is weak. Bell's palsy is a very common affliction where half of the face kind of droops down. Palsy is what happens when somebody's having a stroke and they no longer can function well, and the muscles kind of are flaccid for a while. Usually it's temporary. You can have a loss of taste, and you can have decreased salivation. Number 8 has a very long name. This one is called the vestibulocochlear nerve. And it's not hyphenated, I just did because I can't fit it all in one line. But this is sensory for hearing and balance. So we could have a loss of hearing in one or both ears. And we can have a loss of balance, or a sense of that you're not right, that you're not upright, that you're falling. So that sometimes is called vertigo. So it's a fear of, or not a fear, but a feeling of dizziness, that if you spin around really fast and you get dizzy, it would be like having that without spinning around.